Hi, my name is Glenn Hemberger, and I am honored and humbled to accept the Dentist of the Year award. I thank you, the selection committee, for considering me. I'm honored to be included in a list of what I consider incredible professionals that went before me. And I had the honor of working with a lot of these professionals, and that's been very gratifying to me. When I look back at my profession, what kind of got me to this stage, everything from the 5th District presidency and different offices that I held there, and then of course the Kansas Dental Association when I went through the different offices there. When I became president of the Kansas Dental Association, I got to meet many members, particularly in the annual meetings in which we went to, and of course at the Kansas Dental Association annual meetings, the district annual meetings and the Kansas Dental Association annual meetings. And I heard two main concerns when I went there that registered with me particularly. And one was the ability of the dentist and the patient to be the priority in the decision-making process, and third parties not being that decision included in that decision-making. And the other was the viability of the private practice itself. This could face the force competition from corporate dentistry. When I look back, also I might say that the Kansas Mission of Mercy projects, which I was privileged to participate in all 9 of these working side by side with such dedicated professionals. It's very touching to me to see people wait in line for 12 to 24, even 36 hours to receive a very much needed treatment. And then to see at the end of the day tireless professionals like oral surgeons not even being able to make a fist at the end of the day, hygienists not being able to stand up straight because of the early projects in which they didn't have the equipment that we now have. To also just to work side by side with my colleagues that we in the pediatric dental area, as we went chair to chair, and their staff became my staff became their staff. These are experiences I'll never forget. We were simply doing what I consider God's work, but we're doing it actually just by our own profession, what we do naturally in our profession. When I look back in my Pediatric Dental Association during my presidency, one of my major passions, of course, became elder care. And this may seem rather strange for a pediatric dentist to have a passion about the oral needs of the older population. But to me, they are the most neglected part of the population. And their needs greatly increase, and their ability to receive treatment greatly decreases. And so my final plea is to all dentists to look in their practices. If you have a patient that you've treated for 10, 20, 30 years, and all of a sudden, as they get older, they do not make their checkup appointment, my plea is to follow up and find out what happened to them. They may just have the inability to come to the practice anymore. Maybe someone forgot. Maybe they forgot. But please do follow up on them, and I think we all owe it to our patients who have been with us for many years. And please do pay special note to all the needs of the elderly population, particularly those in assisted living facilities. With this, I thank everybody, and I thank the Kansas Dental Association for having the privilege to serve with them and to associate with all their members.